Hello. Today we'll be talking about the difficulties with EMS professionals' recognition of individuals on the autism spectrum. I have served 15 years in EMS, and in that time frame, I myself have come across many patients that fell somewhere on the spectrum. You see, autism is not a disorder that is easily seen. It can't be picked out of the obvious diseases or ailments that affect a large number of the population. Autism is a disorder that truly takes practice to understand, rather than just deal with. As first responders, we are more likely to come across a person on the spectrum than the average Joe, and knowing how to respond and understand the needs of those individuals is vital to their immediate treatment and care for the emergency. To understand the effects that autism has on someone is not easy. However, an example would be walking into a sports bar and having all the TVs on, and instead of just hearing the one that you're watching, you hear all of the TVs on at the same time, making it impossible to focus. Some of the other telltale signs of a child on the spectrum is the tiptoeing while walking or the flapping of the hands. Other behaviors that the EMS worker can look out for are the pacing back and forth or the overwhelming need to avoid contact. In traumatic situations, such as a car accident, it is very important to recognize that the nonverbal part of autism may be present, and the child or adult may not want to obey the commands of the would-be rescuers, thus making it difficult to achieve the safe extrication of the patient. In closing, it is important to be able to recognize the signs of someone with autism and know how to respond to them. Keep in mind the mental capacity is far beyond the norm and we are simply existing in their world.